know that you're having some trouble with your memory, and so I wrote you a note so that if you forget, you can remember everything we talked about.
Okay.
Okay.
Students are learning about what it's like to age, be in their 80s and 90s, and what it's like to have dementia.
When you're older, that task might take 50% of your mental capacity. So multitasking is hard.
We're simulating the aging process in dementia today by having them wear plastic pegs in their shoes to throw off their balance slightly and also simulate neuropathy. We are having them wear goggles to simulate cataracts and macular degeneration. And we're having them put earbuds in their ear to hear the sounds that a lot of dementia patients tell us that they hear.
Lack of dexterity and arthritis.
By 2030, there will be more older people in this country than there are kids in school. Most of the students and health professionals will be working with older adults.
As clinical care practitioners, we're going to be seeing a lot of patients who are older, so it's important for us to really have compassion and empathy for older adults.
We can talk about dementia, and we can talk about aging, and we can read about it, but until you actually simulate and experience some of the things that someone who is older or who has dementia has, it's not the same. You can't be as empathetic. And by having hands-on simulation, experiencing what it's like to lose your concentration, experiencing balance issues, experiencing dexterity issues, all of those will help them do a better job at problem solving when they're treating someone or caring for someone.
I really forgot what I was supposed to be doing, and then not being able to hear, so being distracted, and it was really hard to see, especially I never thought those clear plates would be so hard to visualize. I'd sit it down and then I'd go to the other side and or look around, and I couldn't even see it because of the goggles. I had to kind of start telling myself what was next and kind of repeating it in my head so I wouldn't forget or get distracted. I think I'm going to view older adults a lot differently and just have a lot more compassion, because one thing I was noticing is I was starting to kind of talk to myself to really hear that, and sometimes I feel like you can see people talking to themselves, and I think there's a bad stereotype about people who talk to themselves, but really it's a survival skill and it's really necessary. Things change and life isn't always that easy, and we all need help at some point in our lives.